Imagine a world where a simple cut could kill. This is the terrifying reality we face as antibiotic-resistant superbugs become more prevalent. By 2050, these superbugs could be responsible for 10 million deaths per year. This silent pandemic threatens to undo decades of medical progress. We must act now to prevent this future. Antimicrobial resistance, or AMR, occurs when bacteria and other microbes evolve to resist the drugs designed to kill them. Overuse and misuse of antibiotics are major contributors to this problem. When we don't use antibiotics correctly, we create an environment where resistant bacteria can thrive. These resistant bacteria can spread easily from person to person. They can even spread from animals to humans. This makes AMR a global health threat that requires a global response. We are all at risk. The rise of antibiotic resistance is a direct consequence of our actions. For decades, antibiotics have been overprescribed for illnesses they can't treat, like viral infections. Patients often demand antibiotics even when they're unnecessary, and some doctors prescribe them to avoid difficult conversations. The agricultural industry also plays a significant role in this crisis. Antibiotics are routinely given to livestock to promote growth and prevent disease in crowded, unsanitary conditions. This practice creates a breeding ground for drug-resistant bacteria, which can then contaminate our food and environment. We must address these practices urgently. Reducing unnecessary antibiotic use in healthcare is critical. Doctors need to prescribe antibiotics only when necessary and educate patients about their appropriate use. In agriculture, we need to transition away from factory farming practices and explore alternative methods of raising livestock. The burden of AMR is not distributed equally. Low-income countries with limited access to healthcare are disproportionately affected. These regions often lack basic sanitation and hygiene, making the spread of resistant infections more likely. Furthermore, the elderly and immunocompromised individuals are particularly vulnerable to these infections. Their weakened immune systems struggle to fight off even common bacteria, making them more susceptible to serious complications and death. This disparity underscores the urgent need for global cooperation. Developed nations have a responsibility to support developing countries in their fight against AMR. This includes providing financial aid, technical assistance, and access to essential medicines and vaccines. Section 4, a global effort combating AMR together. Combating AMR demands a multifaceted approach involving governments, healthcare providers, the agricultural industry, and individuals. International collaboration is crucial to share information, track the spread of resistant bacteria, and coordinate research efforts. Investing in research and development of new antibiotics is essential. However, this alone will not solve the problem. We need to focus on responsible antibiotic stewardship to preserve the effectiveness of existing drugs. Public awareness campaigns can educate people about the dangers of AMR and promote responsible antibiotic use. Simple measures like hand washing, vaccination, and safe food handling can significantly reduce the spread of infections. Section 5, Hope on the Horizon, New Treatments and Responsible Practices. Despite the grim statistics, there is hope. Scientists are exploring innovative treatments like phage therapy. Phages are viruses that can target and destroy specific bacteria, offering a potential alternative to traditional antibiotics. Furthermore, increasing awareness and changing practices are showing promise. Some countries have implemented successful programs to reduce antibiotic use in healthcare and agriculture. These efforts demonstrate that change is possible with collective action. The fight against AMR is a race against time. By embracing responsible practices, investing in research, and working together, we can prevent this silent pandemic from becoming a global catastrophe. Our future depends on it.